Well, thanks for having me, Peter. I really appreciate the opportunity to speak. My name is Rohan Ramakrishna. I'm a neurosurgeon by background and take care of patients that have malignant brain tumors. And while I was taking care of patients several years ago, I had this observation that just kept happening again and again, which is that people were coming to my office and finding things on the internet to help treat their brain tumors. But so much of what they were finding was misinformation or even disinformation. And they were actively being harmed by the information they were finding on the internet. And I got to thinking, how is it that Dr. Google and WebMD are the best things we have at the time, 2020? We're sending probes to Mars. We're sending probes to map the subsurface ocean of Europa outside of Jupiter. But WebMD and Dr. Google is the best patient information experience that we have today. How is that possible, right? And so I thought the whole space needed a radical rethink, and really partnered with two of my other co-founders who were senior people at Pinterest, because I thought we needed to take the best of consumer thinking and the best of healthcare and medical thinking and combine them into a new healthcare information experience. Just to put some numbers around it, 7% of Google search is health information search. Is that right? And what that turns out to is 1 billion searches a day and 40 million in just an hour. And so why are people doing that, right? Why are people searching so much? I think if you think in the context and background that we have limited time with our doctors, the average medical appointment, depending on the country, is somewhere between 11 and 18 minutes. Yeah. And we have poor access to doctors, right? The ability to even get an appointment once it can take a long time. So when you think of that context, it's no wonder that people are desperate for more information, because what's more important than your health, right? Yeah. And so what we do is we say our goal is to provide a personalized guide for everyone's health journey, right? That's rooted in the best medical evidence and powered by doctors. And we use AI, interestingly, and AI seems to be a big theme of this conference. Of course, yeah. We use AI to help really understand our patients' needs, our caregiver needs, and then map them to the best medical answers. So the atomic unit of Roon is video-based Q&A provided by doctors. So we have tens of thousands of patients now, more than 500 doctors. So people have really started to resonate with the product we built.
Interesting. And so, yeah, well, this is the thing, that there's so much information that's generated every day, and so many different perspectives, which seems an interesting thing in and of itself, and something that one would think, coming from outside of medicine or healthcare, that there would be, well, this is, it's quite black and white when sometimes it's not. How do you, is there even a possibility to have a source of truth of this kind of thing? We've got cultures and types of medicine and I guess just the evolving nature of it, new research always coming through. Yep. Are we just saying, well, this is going to be, this is the leading star here, or is it somewhere kind of in between?
I love that question. So, who owns the source of truth for medicine? Open question to you. Nobody. Yeah. Nobody owns it, right? And why is and how do you create the source of truth? So number one, it has to be an evolving dynamic system, right? It has to be one rooted in the best medical science that can change when it should change, right? And so our system actually is the source of truth we're building is powered by doctors, right? Right. So doctors on Roon own the source of truth. They're creating the source of truth for medicine, and they're updating the source of truth when and if it needs to be updated, right? And so that's our thesis, right? You need to build a new healthcare education platform. You need to recreate or create anew the source of truth for medicine. And the best stakeholders to do that are doctors. Yeah. And it's actually not just doctors. So we believe in a holistic view of how health information should be consumed. So part of it's the expert physician, but part of it's the lived experience also, right? So in addition to doctors, we have patients, we have caregivers, we have social workers, really anyone that can opine and has an expert lens on some aspect of a health journey, right? So sometimes you want to know why I need chemotherapy, but other times you want to know what the experience of chemotherapy might be. And that's a much better answer supplied by a patient than a doctor, right? Or, what if you have ALS is one of the conditions we serve, right? And so if you're wondering about disability, disabilities and how to get in and out of wheelchairs and car modifications, home modifications, doctors have no clue. Yeah, but patients and caregiver families have in-depth earned expertise in those areas. And so we bring all of them onto the platform in a vetted way and really build this new source of truth anew. And then because it's dynamic, the system knows when things need to be, and we use AI for this as well, the system knows when it needs to be updated. And so based on things that are coming out in the news, new literature is being published. And so that kind of feeds our content engine so that doctors can opine on the latest research.
Yeah, got you. And so who are you engaging with them? Like, who pays for this thing?
So right now we're a post-Series A company. Some of our investors include Sequoia and FirstMark. And we're pre-revenue. And so right now our goal is to really build out all of human health, through our system. And so we have a pretty bold goal. But thankfully we have the backing to hopefully do it over the next year. And in terms of the revenue model, we have multiple options available to us, but the ones we're exploring are freemium and sponsorship type models, right? That again, rooted in trust, and through medical education. Editorially, one of the commitments we've made is we will always control that. That will never be up for sale. But through life sciences and biotech, I've been excited about educating the public, right? Being more direct to consumer. You've seen more of that effort in life sciences, like Eli Lilly has Lilly Direct as an example. And so I think they're anxious for new ways to engage their customers, and they really love the way that Roon kind of galvanizes the medical community across all its different stakeholders.
I'm interested from the content perspective, because content seems to be my life at the moment. And in terms of how different people like to consume content, I think at some point you mentioned that video is kind of like a base unit, or that like there's video content there. People like to consume content different ways. How does all this, like, say you got your source information there, does it get served up in different
Sure. So, like you said, everyone has a different learning style. But from first principles, we believe that the video-based Q&A unit establishes trust. There's an infinite amount of written content out there, right? And so patients, we've learned, don't like to read PDFs, long PDFs. They throw them away. The pamphlets we get in the doctor's office are usually boring to the point of useless, right? And so our, again, Q&A format is the atomic unit of the service. But if you're a reader, you can get a quick AI summary of the video. When you ask a question on our service using our AI Instant Ask feature, it gives you first a text-based multi-perspective answer, and then shows you the source videos from where those answers came, so you can go in deeper. And I think that's another important point, is that we offer a multi-perspective answer on a question. So remember, so much of medicine is not governed by phase 3 clinical trials, and nor will it ever be, right? There's lots of gray area in medicine. And so we don't hide from the gray. What we say is, let leading experts explain their opinion and why, right? So, for example, there's some debate about the ketogenic diet in cancer, right? And so we have leading experts talking about why they feel ketogenic diet may or may not be useful in cancer therapy, right? It's unsolved science. But our view is, let the leading experts talk about it. You can consume it if you're interested in that as a patient. And then we at least have that perspective out there. Because if you don't, what do people do? They end up in a misinformation rabbit hole. And so I think we try and address all those different things, not just the hard questions about or easy questions necessarily about, why you need chemotherapy, but, what about all the different supplements that are being marketed? What about, I'm worried about, I have existential questions about mortality, so we have spiritual leaders on the app even,
Right.
So a lot of these healthcare questions that come up, we can find, they're all over the internet with poor answers. And so what we do is get all the world experts to come and talk about it.
Excellent. And lastly, then, we're at Health. I believe you're up on a stage at some point earlier in the week. What were you sharing up on the stage?
So I was on a panel called The Whole AI Iceberg. And the idea was to talk about how companies are using AI in their operations, et cetera. And so we had a number of panelists, one from GE, one from Kaiser Permanente, another from a biodiscovery lab, and then me. And so what I talked about was how we use AI in our company. And we basically use AI to make humans shine, right? AI to us is a tool. It's a technological tool that really allows us to understand, and in a level that is unprecedented. That's what large language models are really good at. Like, what specifically are you asking, right? Because no two patients may ask the same question the same way, right? And so we could figure out using AI what you're asking, and then give you an answer based on the answers we have already, if we have them, right? And so we really use AI to curate and to package and to guide, but really use it to help humans shine, I said.
Excellent. And so what we're looking ahead then over the next 6, 12, 24, where are your priorities at for Ring?
So, right now, post Series A, we're growing our company rapidly, and so we're hiring. So we're looking for a head of women's health. And so anyone that's interested, that's in the U.S., please definitely reach out. We're also upping our engineering team to keep developing new products and features that our patients have been asking for. And then in terms of product, we'll be continuing to help curate and contextualize the answer to give you the best possible experience as a user.
Yeah.
And part of that is going to also include scaling up the number of conditions we serve, right? So over the next 12 to 18 months, really want to kind of cover 80% of the use case of why people are searching online, and really cover hundreds and hundreds of conditions to really make it as useful as possible.